and surviving open enrollment for 2015. Typically, I go through the list of how to ask a question, and I will do that as well. But I thought, for those of you that are new to our weekly webinars, I thought it was important to kind of go through again how to ask a question. You can type questions into the question box at the bottom of the screen, and you can also raise your hand. So, if you do have a question, go ahead and do that. Today, in particular, I thought, with a show of hands, who is tired already from this open enrollment period? Yeah, there you go. And the screens are lighting up, ladies and gentlemen. Anyway, so we'll get on to the program. I know you're all anxious to find solutions to make this enrollment easier, and we are as well. And just an update, as I always start with our web broker and enrollment portals. We are working through EBIX to build our platform. They are very close. We should have most of the carriers on there by early next week, quite even possibly by tomorrow, by the end of this week. Right now on the EBIX portal, there's Health America, CAP Blue Cross, UPMC, Blue Cross of Northeastern PA, and Aetna. They have all of the information and are in the testing phases for Independence Blue Cross, Highmark Blue Shield Central, Western Highmark, Assurance, United Healthcare, and Geisinger. So, it is a work in progress, but we do really feel that it's worth the wait because it is going to offer on and off exchange enrollment, and there will be a consumer interface which would have everything geared towards you. You would get credit for the sale. So we do think it's going to be the best of both worlds. We do have, certainly other options available. There are carrier enrollment portals. As of Saturday, they've been on and off, and some have worked well, some have not. Again, I don't think there's a magic bullet out there. One size fits all. That's why we're really going to market with various options for you to make it easier, to not only make it easier on you, but make it easier on us. So keep watching for additional information. I do have a lot of my agent partners interested in our EBIX system, have already signed up, and I'm really just taking a list because, quite frankly, I don't think that at this point signing you up and starting to charge you is in your best interest. I'd rather wait till everything is in place. If you do have an interest in using the EBIX portal, the cost is going to be between $75 and $80 per month, and if you have any interest in doing that, we will be running some webinars to show you how to use the system, how the system actually works. But shoot me an email, and we'll get you on the list to at least have contact with you for follow-up. The next bullet point I think is pretty important and very exciting as well. Last year we ran a test program or a pilot program for enrollment services. I can tell you that there was an advantage and disadvantage to it. It worked well, maybe, sometimes, but for the most part it really was a huge drain on everyone's time, and we knew for 2015 we were changing it. What we had to wait for was the portal that we were testing to get the new system through, and I'm happy to report we've had great success with this. So we are going to be launching enrollment services again, whether you are certified in the FFM or not. You're going to be able to utilize the system, and essentially what it is it's reduced the FFM enrollment for, of course, on exchange to a data entry functionality, and we're really, really, really excited to be offering it. Basically, what the requirements would be to have your client, if they're interested in FFM, if you know that they're subsidy eligible, to complete a healthcare.gov paper application, and you as the agent would narrow down the plan choice that they want and their estimated subsidy. And you can do that by going on to healthcare.gov, doing an estimated subsidy and narrowing down the plan, faxing that over to us or emailing it over to us, and then we enter that on the FFM directly on your behalf. It would, you know, there's an extra step required for reporting of the application, but again, for the most part, we really think we have a pretty good solution for those of you that want to be, for the most part, hands-off. So keep watching for those details as well. You know, for off enrollment, for a 12/1 effective date, November 26th, which is the Wednesday before Thanksgiving, we are asking that all of the applications are at our office no later than 3 o'clock on Wednesday, November 26th for processing for a 12/1 effective date. So please be mindful of those times so that we can get the business processed for the 2014 year. The next bullet point is healthcare.gov. You know, you can go out onto healthcare.gov and do the preliminary rates. I think it's a good solution right now to see all of the plans, and you know, there are still issues with it, of course, but that is a source that you can use to look at rates for all carriers in your areas. Also, please rely on us, you know, either myself or your case manager, rely on us. We can provide the quotes for you for the individuals, and we're happy to do that. You know, we don't want you out there wasting time, and we know that it's a drain on your time as well. So please rely on us. That's why we're here, and hopefully that's why you choose to do business with us, because we are your back office support, and we do want to fully support you in your sales efforts. The next bullet point is about the Highmark Blue Shield renewal letters. It does appear that there are some renewal letters going out talking about renewal options, and those rates may not be accurate. So just be mindful of that. Again, the best thing to do is stay in front of your clients, contact your clients, because quite frankly, if they get rates that are higher than they would actually experience upon renewal, and you're not in touch with them, they're going to reach out to somebody else and try to get a better deal and cut you out of the process. So I do want you to be mindful of that. I know time is precious, but I do think it's important that because you worked so hard to keep those clients in 2014 that you retain them and not lose them because of being too busy. You know, 24 hours in the day, I understand that, but even if you do a mass email or just a letter to your clients, letting them know that you're there to assist them, I think that will help. You know, Highmark was, for Central PA, one of the top carriers in 2014. So Highmark does have a very great portal out there. They're having some issues as well, but it is a place where you can look at all of your business and do the enrollment either on or off exchange. Of course, on exchange is having some issues with the redirect, and that appears to be the case for most of these portals. Again, just keep in touch with us, and we'll help you through all of these issues. I wanted to, you know, from time to time, I think it's important to mention some of the other training sessions that some of my, you know, comrades in arms here at URL, some of their training sessions that they're running. And Steve Clemens is running a webinar. Steve is our Vice President of Life Markets, and he's running a webinar on December 11th from 11:30 to 12:30 that I think is timely, especially for those that also are in the senior market. But for those that are in the under 65 market, I think it's well worth your time as well. But it's called the Postseason Game Plan, and I think it's going to be very instructive, talking about how to sell final expense and other life products that may be of interest to you. So I would just mention to you, if you are interested in participating, go to our homepage under current events. You can go to the calendar on December 11th and click on the event and register right from there. Even if you register and can't attend, you will get a recording. So again, it is something that I think will be beneficial to you. So if you're booked that day, at least take the time to register. I think that will definitely be something worth your time to at least listen to later on. Continue to check our website. I'm going to take you there right now to show you a couple of the features. Under Health Plan Options, you'll see under the product information, under the federally facilitated marketplace forms and links, this has been updated. This is the FFM site, of course, the 2015 FFM application. Again, if you're going to take advantage of these enrollment services, the FFM application is there, hardship exemption form, the one-page guide, quoting tool for the FFM, 5 steps to staying covered if you have clients that you wrote on the exchange in 2014. This, again, just household size, a variety of links that are specific to healthcare.gov. This link now is live, so if you are writing FFM applications and I would encourage you to avoid some of the issues that we experienced this year in getting you paid and are still experiencing. Go to this Upload Submitted Applications. It's very easy to complete. Your name, first name, last name, your email address, your client's first name, last name, the insurance carrier that you wrote, the insured date of birth, insured social, the effective date, and then you also can upload a copy of that application. This will go right into our CRM system. So from the time it hits our system, we're going to be able to be aware of the case, first of all. Some of our internal reporting will allow us to be proactive if a couple months go by and no commission has been paid. We're going to be able to track that as opposed to waiting 6 months, going through the process of trying to figure out if the carrier has the app, if they have you hooked into the app, if we were paid on it, why we weren't paid on it, why you weren't paid on it. So I do think it's a very useful tool, and please, for anyone submitting on the FFM, I would encourage you to do that. So back to the slideshow. November 21st, which is tomorrow, we are working extended hours. Again, we're trying to, for key dates, stay open longer or work extended hours so that we're here to help you through this convoluted, at best, process. So tomorrow we will be open from 8 to 3, and we're happy to help you with any of your questions. So we're here to answer your questions via email, process your business, and we're available for calls as well. Just a note, for next week, of course, that is Thursday, November 27th. That is Thanksgiving. I will not be running a webinar, and I'm sure you will not even care that I'm not running a webinar. So the next webinar will be 2 weeks from today, and that's going to be Thursday, December 4th. So at this point, we're going to go through the open forum and open it up for questions. I do have quite a few questions. Let me go through them. If again, if this is your first webinar that you're joining, you can either type in your question in the question box or raise your hand, and I'd be happy to unmute you, and you can ask that question live. So let's start. Jen says, do you know what the qualification limits are on Medicare for PA? And I do, Jen, and I can show you a chart. This I've been sending this out to those that have requested it. I can send that to you as well, Jen. You can brand this to your own agency name. It's a health insurance what you need to know. This chart, and I'm not sure if you can see it or not, this chart is available, and actually I got it from healthcare.gov, but what it says is, this first block is for those, for the 100 to 400% of the FPL. This is the 100 to 250. This third block is the 133% level. So if you have a family of one and they make below $16,105, then they're below 133% of the federal poverty level for 2015, so they would qualify for Medicaid, either the traditional Medicaid or the Healthy PA. So what that translates to is anyone from 16,105 to 46,680 for a family of one would qualify for a level of subsidy. And then, of course, for the cost-sharing subsidies, the 16,105 to 29,175. So I'm happy to send that out to anybody that wants it. Just shoot me an email, and I'll get that out to you. Is EBIX in place of Health Connect quoting portal? Yes. EBIX actually acquired Health Connect, and is that charged for EBIX per user or per company? It is per company, and you know, it can have up to 3 users. So if you do have a company that uses multiple users, then we can get you all under one contract, one monthly contract, or one agency contract. Jen says that she has clients who forgot their healthcare.gov login information. They created an email address for, specifically for healthcare.gov and never checked it. Is there a way to recover it through healthcare.gov without calling in? The only way to do that, Jen, is to go back into healthcare.gov and go through the forgot the password. If they can't remember their email, then they are going to have to call in and see if the people in the health insurance marketplace can help them. The charge for, Kim's asking the charge for enrollment services. We're still working through the details, but it is going to be minimal at best, and depending on, you know, how this really works out, you know, we'll make that determination. But again, we should have something formal in place, released no later than Wednesday of next week. Jen says, with Highmark Western PA, do we need written documentation allowing us to send them the blank application, or is this only if we complete the application electronically on the client's behalf? I would imagine that you're asking, Jen, that when you go into Highmark Blue Shield or Highmark Blue Cross Blue Shield to do an application online, you don't need written documentation allowing them to complete the application for them. If you're sending them a blank application, they would be signing it and sending it back to you. You can do data entry directly onto the Western Highmark Blue Cross Blue Shield portal, or you can send that to us if you're licensed through us, and we do that. Our data entry team does that. So if you have a paper application for any of these carriers and it's off exchange, you can send it to us and allow us to enter that for you. Jen also asks, how are the carriers ranking by price? Is one pulling away from the pack like Highmark did last year? And yes, it does seem, you know, again, it varies a little bit, and we're still early in the game. You know, Capital is coming in for Central PA very competitive, but you know, it does appear that Highmark is coming in as the carrier again for the stronger plans. Coventry is doing a great job in Central PA. They have HMO products. Their deductibles are higher, though, so you know, when you see a higher deductible, of course, the rate should be lower. So you know, it's a little hard to tell right now, and but it does look like for the most part, for Central and Western, Highmark is doing the best job again. Geisinger is still doing a nice job up in Northeastern PA. It does look like Aetna might be a little bit more competitive for some of their plans in Southeastern PA. So that's kind of the view so far. Jay says, looking for clarification on this better deal and other brokers' ability to write business on business we created originally. So a new agent can parallel a new plan with the same carrier, example, Highmark, and a Highmark with a lower premium. I'm not sure I know what you're talking about, Jay, other than agent can parallel a new plan with the same carrier, example, Highmark, and a Highmark with a lower premium. Yeah, Jay, you're going to have to call me on that or shoot me an email because I'm not sure what you're asking on that. I can tell you that another agent does have the ability to go in and if your client logs in and contacts another agent for a 2015 plan, they can add another broker, change the broker, or if, that's the bad part. The good part is if they went through the system last year or for 2014 and didn't have an agent attached to a case, you can be added. So that's the good news and the bad news. Again, Jay, call me and I can get clarification. And Jen says, how does find an agent actually work on healthcare.gov? I haven't been able to find it like I was able to before November 15th. And I agree, it is hidden. What you can do is there is information that's typically at the left-hand side of the screen that talks about finding an agent. Unfortunately, it does appear that the navigators and the associations come up first. But if you drill even further down, you can get to an agent, and then it will come up. I don't think it's the best system, and unfortunately, I don't think that it's something that is right in anyone's face to choose an agent when they're trying to make application on their own. So I think that is a work in progress, and I'll try to get some more information on that. We were supposed to get information on how to update your information and the way the system works, but we've not received that yet. Tracy says, Deb, do we add renewals also? I assume you mean to that FFM system? No. You only need to add, add new cases. And I would suggest that if you do renew somebody, if, for instance, Tracy, if you wrote a BC NEPA case on, Joe Smith last year, and they're transferring for 2015 to a Geisinger plan, let your case manager know that. But I don't think there's, at this point, any need to upload that information. That may change, but for this time, let's just keep it to new business and then notify your case manager. John says, Highmark renewal letters. Are you saying that Highmark is overstating the premium due for January 2015 while what healthcare.gov is indicating in the correct premium calculation? Yes. It does appear that at the very least the premiums are incorrect. The one example I saw, the premium was about $30 or $40 higher per month. So I know Highmark is aware of the situation. There was also one that I saw that was lower. Again, it's hard to say, but it does appear that the premiums are not totally accurate that are coming out from Highmark, and to just reach out to your clients. It's the best I can advise you at this point. Bill says, we have been actually doing re-enrollment applications, and in several circumstances where income will remain the same, the client is receiving more tax credits than last year. Coupled with the fact that we are seeing base premiums lower than what clients are seeing in their renewal letters, they end up with a higher premium than before but lower than the renewal letter is stating. Okay, so Bill just kind of explained what Highmark, what he's experienced with Highmark. Jen says, you showed us how to upload the client into your healthcare.gov system to keep record of it. You said we can upload the client's application, but I've only seen where it creates a web link to access the application. I haven't been able to save it as a PDF like last year. Is there a way around this? Jen, I don't know. I will find out. I don't know. Healthy PA, Frank says, Healthy PA is the Medicaid expansion for Pennsylvania that's effective 1/1/15. We don't have a lot of information on it right now. It's not going to be on the PA Compass site until 12/1. So at this point, we don't have a lot of information on it other than to tell you that it is based on the same plans that everybody else is buying, the silver, gold, platinum, etc. It's not, the high-end Medicaid plans that are out there right now. It's something different. It's not commissionable. It is subsidized, and there is, from my understanding, a rolling sort of amount that a client would have to pay based on their income. They could pay a higher copay. There is some different cost-sharing options in the Healthy PA. We're going to have more information as of 12/1, but at this point, again, it's not brokered. It is just something that if your client is 133% below or below 133%, that they would have an option to choose. Lots of questions today, I'm sure. Jay says, are others finding that carriers are sending out messages to renew and that the client does not have to do anything, and then a week or two later the client is then receiving notice that they will have a premium increase? This does not seem to be right and has confused many clients who are receiving this type of mailing. Yeah, they don't have to do anything if they want to keep their same plan. The rate notification is the notification required to let them know that on that plan the rate is increasing. I think the way it's working, Jay, is because the rates were late being approved and the notifications had to go out. So, you know, nothing is as it should be. I have no control over any of these things. All I can say is stay in front of your clients. That's all I can tell you. Joe says, are kids under 19 still going to get dumped to CHIP? Seems we just can't write families with kids under 19 unless they show proof that medical assistance denied them. And yeah, that's still the same thing, Joe. I think the figure, the actual figure is 317. That's 317% of the FPL. If you have a family that has that 317 and below, they are, and a child 19 or below 19, they are eligible for some sort of subsidized CHIP or medical assistance, and they are not allowed by law to stay on the health plan with their parents and receive any subsidies. Their subsidies lie in the Medicaid system. Jay asks, would it be safe to assume that we should not use the current plan enrollment services that is on the URL website? No, you can use that. Oh, the enrollment service, the easy enrollment, no, don't use that. That is going to, that's totally different. That's for this year, not for January 1st effective date. And as far as the EBIC system, you can use that. It's for anyone that has the update, and I know you do, Jay, or I believe you do have the upgrade. That is going, the current upgrade is only for off exchange. You would have to add the on exchange functionality, and again, that's just shoot me an email and we can get you hooked into that. Vivian says, the main way to see how much subsidy a person is qualified for, do they have to complete the entire enrollment online or find the subsidy amount they qualify for to look at plans available, pick a plan, then fill out the app and sent to you? I know I didn't read that well, but it, I'll show you right now. If you go to www.healthcare.gov, this is the best way at this point. See plans and prices, zip code, get started. If you know they're not subsidy eligible, go ahead, continue. You can put in some, you know, large income. If you think that they're not, let's do 25,000. Continue. Let's do a 35-year-old parent. You can either add more people, or if let's just assume this is single. This estimated eligibility is saying $80.53 per month. Continue to plans, and you're going to see all of the plans. You can, you know, look specifically for a plan. You can look at pricing, less than 200, less than 300. You know, you can narrow it down by by metal level, by coverage type. So at this point, I think, you know, if you're using the enrollment services that we're going to be launching, this is where you would go. You know, you would put on the application, you know, estimated subsidy $81 a month. If they chose the Geisinger health plan, then you could do a screenshot and send that along, you know, so that we know, because again, we're trying to create it as a data entry functionality so that everybody can take advantage of these programs. All right, back to the questions, because there are a lot today, and that's good. I know everybody's struggling. Amy says, would your staff also be able to run shop quotes for us? Yeah, that we could do that. If you're licensed with us, certainly, Amy, for groups. I can tell you that the shop quotes on healthcare.gov, that doesn't seem to be working well either. The carriers can run shop rates for you and us as well. So we're happy to do that, Amy. You know, just send in the census, make sure that you notify us that you are looking specifically for shop rates. Tracy says, does that go for NEPA and Geisinger also? I have renewed a lot of my old clients because the premium is also different. Tracy, I'm not sure what you're referring to because that was probably 50 million questions ago, and I can't remember if I really don't know what you're asking, Tracy. I'm sorry. Joe says, you are probably aware that Geisinger did a mailing to current clients with renewal info, no mention of call your agent, but my question is, are they only offering 2 platinum plans now? It says HMO, does that exclude providers in the Lehigh Valley hospital system? On our site, you can see the Geisinger grid. Of course, you know, all the rates are on here that we have. Geisinger does have a grid that talks about the mapping, and let me see here, the renewal mapping. So they are only having the 2, oh goodness, the 2 plans. I have too many screens open here, folks. There we go. The 2 platinum plans. They're these were last year, and they're mapping to this. And this platinum is going to be a gold now. So yeah, just these 2 platinum. I can check the areas, Joe, to see about the Lehigh Valley and get you that answer as well. And let's see here, continuing on with the questions. Ann says, if we have someone that qualifies for Healthy PA, how do they apply? They would go to the PA Compass site, and they can apply through healthcare.gov, but quite frankly, I think the PA Compass site is going to be a better option if you know specifically that they already qualify, and you're not going to be able to have them apply until 12/1. It's not going to be available on that site until 12/1. Cindy says, any recommendations on the best procedure, if any, to cancel a plan off exchange because they want to move to a new carrier? We want to avoid the individual being auto-mapped and enrolled, billed for a plan. Yes, I would say make sure that client either calls into the carrier or writes a quick note stating that they're canceling and the effective date, and make sure you get that to your case manager definitely by 12/15, because after 12/15, at this point, they're going to be auto-mapped. Now, you know, it still doesn't mean that they're going to, you know, have that plan as of 1/1, but with everything coming in, these carriers need notified sooner rather than later. So 12/15, keep that date in mind. Get us a termination notice or have your client call the carrier directly. Vivian says, the prospect needs to have a healthcare.gov login to get the subsidy amount correct. No, you don't have to log in. To get the correct subsidy amount, you would need to log in, create an account, and actually make application. But to get the estimated, you can go directly to healthcare.gov and look at the rates and plans. Joe says, if they get denied medical assistance, then I can answer the denial question, and it seems to allow them on Obamacare program. Absolutely, Joe, that's true. Jen says she has a client who has UPMC for you. Apparently this is a Medicaid plan for that child. His prior Highmark plan coordinated benefits with this plan, but the ACA plan I put him on last year didn't coordinate benefits. Is the child supposed to be on the family ACA plan? I've never had this situation before. I don't know, Jen. I'm going to give you a call and we can discuss that one offline. I think that's not an easy answer or just an answer that, you know, is a blanket answer. Vivian says, do you have to have a SHOP FFM certificate. You do. The only thing you need for SHOP for 2015 and for 14 for that matter is the agreement. So if you've not done that, log back into your marketplace.medicare learning network and go to the training and complete the SHOP agreement, and then you're going to be certified to sell SHOP. I can tell you that in Northeastern PA, I'm working with an agent on a group, and Blue Cross of Northeastern PA is the only carrier that has a SHOP program. Aetna, Geisinger, and Health America, Coventry do not have SHOP plans for 2015. Highmark does, Capital does. So I think that's it. Looks like those are all the questions we have, and I thank you very much for all the questions. There is some follow-up that I know I have to do. Jen, I'm going to give you a call. Tracy, if you want to shoot me an email, I can try to answer that question, and keep them coming. You know, again, if you know nothing else, please know that we're here to help. We're trying to make things as easy as possible for you. And, you know, because we do appreciate your business. We know it's a difficult time. We know it's a busy time. So rely on us. We're here to help. And thank you so much for your business and your partnership. We're going to get through this year like we did last together. And, you know, maybe a few drinks under our belts, but we'll definitely get through it. So thanks very much. I wish all of you a very, very, very happy Thanksgiving. And we'll talk with you again. At least on Thursday the 4th. Thanks. Bye-bye.